if you can be remembered, you can be prescribed. And I think that's how we like to approach kind of creative campaigns and creative ads, is to say, hey, you know what? What are the KPIs? Aligning with our clients to say, what do we want to accomplish with this campaign? And then using chess as a conduit to get there, right? It's not the be all end all. You obviously need reasons to believe, you need efficacy, you need safety, but it's about making a real connection with a broader audience to be remembered and be brought up at the time of prescribing.
When you're watching a pharma ad, you're presented with a series of visuals, audio, and text, all designed to grab your attention and inform you of the medication or condition at hand. But what makes a healthcare brand stick? Hello and welcome to the MM+M podcast. I'm managing editor Jack O'Brien. For today's conversation, we're talking with VCCP Health about chess. And by chess, we mean character, humor, emotion, surprise, and sonic branding. I'm pleased to be joined today by VCCP Health's Head of Account Management, Chris Brandow.
Looking to get back in your type 2 diabetes zone? Once weekly Ozempic can help.
Ozempic. Things are getting clearer. I feel free to bare my skin. Yeah, that's on me. Nothing is everything. Trilogy. The power of 1, 2, 3. Trilogy. 1, 2, 3. Trilogy.
Chris, welcome to the show. Welcome to Transform.
Thanks,
Great
Jack.
to have you on the show.
Yeah, thank you. Happy to be here.
And before we get started, this is your first podcast, right?
This is number one.
This is going to be a great conversation. I'm so looking forward to it. I want to start off, we kicked things off with this conversation with some of these pharma jingles that we've seen over the years, namely Ozempic, I think comes to mind for a lot of people.
Sure.
Why is that important? How does it factor into sonic branding?
Yeah, thanks, Jack. So those jingles, Ozempic, Trilogy, Skyrizi, actually are perfect examples of how the brain and how memorability works. People don't remember ads, but they remember those jingles, those earworms that get in your brain and really stick. And we know this because VCCP has conducted some behavioral science research that we titled Cracking the Memory Code. And it's all about what can brands do to make their campaigns and to make their ads more memorable? And essentially, it's an advertising effectiveness study. And what we've learned is that if you use one of these 5 levers that we call chess, character, humor, emotion, surprise, or sonic branding, you're more likely to be remembered. And I think in our industry, that's important because the brands that are remembered are the brands that are prescribed, are the brands that are brought up at that point of care between patient or caregiver and physician. Ultimately, that's what all of our clients want, right? They want to be prescribed. They want to be brought up during those moments that matter.
But that's something that obviously the industry has struggled with for a number of years. I was actually looking at analysis before we started this podcast about the issues with brand recall and pharma marketing. Why is that the case, with this class of companies? Why do they struggle so much with that?
Yeah. And listen, at the end of the day, we're a creative industry, and I guess shout out to any of the creative teams and agencies that have ever made a TVC, because it is highly regulated. And sometimes, it's hard to go into those med legal meetings and say, we want to do X. So I think it starts with, understanding that this isn't just a philosophy or an agency point of view, but this is actually, real science. This is behavioral science that shows that if you incorporate these elements into your campaigns, you're more likely to be remembered. That alone won't get you to prime time, right? What you do need is, I think, a trustworthy relationship between agency and client. And we love working with clients that are brave enough to maybe go outside of the norm, right? Reasons to believe, sell drugs. But these chess moves and breaking through that sea of sameness, I think, is what creates these memorable moments.
So talk to me a little bit about chess, and I know it's more than just a game that people play or a Broadway musical. Talk about what it means in the context of your agency.
Sure. So when we are concepting or when we are coming up with creative campaigns, we like to keep these chess moves in mind. And if you think of some of these healthcare commercials or these pharmaceutical commercials, we can go down the list. Character, right? I'm sure everybody here, if I were to say Cologuard, remembers the talking box, right? And for better or worse, you know you've made it at the center of an SNL skit kind of thing, right? Humor. We saw this over the last couple of Super Bowl commercials. You know, Novartis has done a really great job increasing awareness for prostate cancer, for breast cancer by playing into kind of non-trope like environments and leveraging humor, right? I think the one this past year was
Relax your tight end.
Relax your tight end, right? Very, very unexpected, very funny. Emotion. We've previously, a couple of years ago, I worked on a campaign called The Most Beautiful Sound. And The Most Beautiful Sound featured the sound of cancer cells dying. We played those sounds to actual cancer patients, and seeing them emote and having them hear that, it's a very real and raw and authentic emotion, and people remember that. We've already talked about sonic devices, right? Ozempic and Trelegy and Skyrizi are the ones that come to mind most recently. And then when you think of, you know, the other S, surprise, again, I think we've been seeing more and more of this in pharma ads, like pharma brands acting more like CPG brands. Again, I'll go back to the Super Bowls over the last few years, but you see, you know, Pfizer Oncology having an LL Cool J song, right? So kind of a combination of multiple chess moves. But I don't think people are expecting that from a Pfizer, right? Maybe that's more aligned to a Nike or you know, something else more in the CPG space. But we're starting to see more healthcare brands act like CPG brands. And I think the chess moves help them increase that memorability.
And all this to say that we've seen a lot of different developments from how pharma brands are going out there with their marketing, with their advertising, at a time where DTC is under fire, and that comes from the FDA, comes from moves in the FTC, the FCC, you name any federal agency, it's there. This was one of the panel topics earlier, was the DTC dilemma. What happens if DTC goes away or is augmented in such a way that it's not recognizable to what it was?
Yeah, it's a great question, and it's very relevant given today's environment. I think the panel earlier did a really great job. There's two ways that it could either go. We talked earlier about creating more disease awareness, right? These principles still apply. And then something else is, you know, doctors are people too. And if there were a world where DTC advertising were to be, you know, were to go away, I think you'd see more leaning into the HCP and to the prescriber or the cross-functional team, you know, those nurses, those office staff, because at the end of the day, you know, I think they mentioned it's doctors in their blue jean moments, right? They're people too. Their memorability, their brains work just like everybody else's. And the principles of memory code and memorability, you know, still apply.
I got to ask you the question I know comes up anytime I talk with medical marketers. It's like, this is all good, but, and they always come back to, we work in a highly regulated environment. There's a lot of restrictions. We can't do this. We can't do that. How does chess fit into that greater dynamic that's out there?
Yeah. As an account, you know, a career account person, number one relationship is always your core marketer, right? Who is your marketing point of contact? But you've got to find ways to get your MLR teams on board early and often. And I think it goes with any campaign, really down to any tactic. You know, you need to bring MLR on the journey and let them know what you're doing, but also why you're doing it. So I do think those kind of relationships between marketing agency and MLR, the more that you can talk to them and bring them on board, the more successful you're going to be. You know, we're not saying that we can ignore ISI and the guidance is there, but it's just, you know, creativity is something that measures effectiveness. And I think we need to start to kind of loop some of our cross-functional team members into what we're trying to do to be more effective.
I got to ask you too, you named off the different components of chess. Is that something where it's like you have to put all those together? Can you take one and just make it effective for your business? Like, how many of those moves do you really have to put in place if I'm trying to recalibrate how my brand is performing from a marketing perspective?
Yeah. So the more the merrier, kind of. You don't want to try to force your creative to include all of them. But our studies do show that the more you include, the more likely you are to be remembered. There is more reason for memorability to, you know, the human brain is designed to forget. The human brain is not designed to remember. So if you can kind of take some of these chess moves, multiple chess moves at once, and come up with a really good campaign or make a really good ad, that's only going to help increase your memorability. If you increase your memorability, you're going to see a dynamic kind of increase in your brand metrics and KPIs.
And talk a little bit about that to kind of wrap up the conversation here, because again, it's one of those things where like I talk with agency folks and they're like, okay, but what really is the value of creative here? Like I'm trying to make sure that if somebody has plaque psoriasis, they know that the drug does this, that this is how they talk to their doctor about it. It doesn't matter if I have some sort of, but like I remember the Skyrizi commercials because I hear that jingle and it sticks in my mind. And so there is a value from a creative perspective. Talk a little bit about that link between memorability and commercial impact, because that's something I think that people don't always see the connection between.
Right. Yeah. I think we know that there's something in the ballpark of $30 billion is spent in healthcare marketing every year, healthcare media. But despite that, only 15% of those ads are recalled. So we also know that if a brand is going to be brought up in a conversation with a doctor, it's more than likely going to be prescribed. So if you can be remembered, you can be prescribed. And I think that's how we like to approach kind of creative campaigns and creative ads, is to say, hey, you know what are the KPIs? Aligning with our clients to say, what do we want to accomplish with this campaign? And then using chess as a conduit to get there, right? It's not the be all end all. You obviously need reasons to believe, you need efficacy, you need safety, but it's about making a real connection with a broader audience to be remembered and be brought up at the time of prescribing.
Chris, it's been wonderful to have you here on the podcast. I want to give you the last word in terms of everything that we've talked about here. Anything else that our audience, your peers, or even those who are on the brand side should keep in mind when they think about chess, or at least moving in that direction with their marketing plan?
Yeah, I would say there's a bad rep in our industry about creative, right? Everybody thinks of the older patient walking on the beach with their dog, and then the commercials are just ISI, right? Don't take this drug if XYZ. And it doesn't have to be this way. I think we are starting to see a little bit of a shift of pharma and healthcare ads becoming more and more creative. And that's what we're in industry for, right? We are filled with some of the most creative people in the world here, and we should do everything that we can to make ads that stick, right? And I'll also end it with saying, I think it's a good thing that some of these health and pharma brands are starting to act more like CPG brands, because there's a convergence of this world, right? And I think that's also part of what VCCP's memory code shows, is that, you don't need to kind of think like a traditional pharma brand, but these principles of memorability apply to pharma and health just as they do to, beverage and automobiles and tech. So
I think it's so crucial what you talk about there, where it's like, listen, you're going to have to advertise like a pharma brand. There's no other way around it. But there's something to say that you can't move towards being more like Jeep or Doritos or something like that. So I hope that's something our audience keeps in mind. It was great being able to have this conversation with you. First podcast in the books. You're a veteran at this now. You're a regular.
I had a good host, so I appreciate it, Jack.
Look at that.
Thanks for having us.
I was fishing for that compliment all the time. Thank you so much for being on the show, Chris. I hope you take care.
Thanks, Jack.